Hi there, my name is Katja Berthelette and I will be demonstrating how to insert and remove an indwelling Foley catheter. So, first we're going to look at our physician's orders. So, we have an order to insert a Foley catheter. So, Jake Nursing, FIN number 312654987, date of birth January 1st, 1960, and the doctor is Dr. Skillslap. So it says here, February 7th, 2021, 7:30 in the morning, insert Foley catheter now to monitor fluid balance, intake and output closely. So, I'm going to wash my hands. Pericare has already been performed, so I can grab my supplies that I will need for this procedure. So, knock, knock, knock. I'm doing an entrance safety check, making sure the patient isn't in any distress. Call bell is within reach. Side rails are up. There's no debris on the floor or anything like that. Hi there, my name is Katja Berthelette. I'm your student nurse today. Would it be okay if I looked at your wristband? Perfect. So I'm making sure that it's the right patient. So Jake Nursing, January 1st, 1960. And could you state your name and birth date out loud for me? Okay, perfect. So today we are going to be inserting a catheter in you. So that involves inserting a sterile piece of tubing up your urethra to your bladder. It's going to be held in place by a small balloon that's inflated with 10 milliliters of sterile water. And so that is going to allow urine to constantly drain down the tubing into a drainage bag where we can monitor your output of urine. And the patient is okay with that, so we're going to get set up. So here I have a drainage bag. This is going to be attached onto a non-movable side of the patient's bed. But because this is a table, we're just going to put this right next to our patient here. Also keep in mind, as this is a sterile procedure, that we would like our surface to be at waist height. But again, kitchen table does not move, so it's going to be down here because we can't move the patient's bed up or down. So, going to continue, and we're going to get our tray. That is our garbage. Careful to only grab the 1-inch border. Can grab my forceps here and pull that open so I can put my forceps down in the 1 inch, and we're going to uncover our patient here. Put that off to the side. Okay. And grabbing the 1-inch border, you can take this and place this right there. We'll grab our fenestrated drape and grab there. Place this on our patient around their perineal area. I'll use these forceps again to grab my garbage bag here. Pass that to myself. And we'll just kind of tuck this on the side here. All right. And then we will take our catheter out of the package. So we'll banana peel this. The inside is sterile, so we're going to be grabbing it with our forceps. And, oops, I want the blue packaging with it. There we go. We can place that inside of our boat. There we go. That can go in the garbage. And at this point, I would don my sterile gloves. So banana peel that open, pull that out, throw that one away, and we can lay that down, making sure to only touch the outer 1-inch border of these gloves and making sure they don't snap close on us. Open it as such. And I'm actually going to put on my right hand first. Okay. We'll grab the left hand. There you go, and I can touch my hands together because these are both sterile. So we're going to grab this, take that out of the way, and now I can grab my catheter, remove it from its packaging, place that in the boat there, toss that guy out, and we're going to grab this here. We're going to open up our povidone strips, or our povidone little cotton swabs here, and we can place that back in the boat. Going to uncap this 10cc syringe that has sterile water in it, and we're going to attach that to the catheter. Perfect, and then I'm going to grab the loop here, open that up, and we're going to lube about 6 to 8 inches of this catheter because we are inserting into a male. We're just going to get all the sides there. Perfect, and we can toss that out. Now at this point we can move our sterile boat over to the patient. Alrighty. And now I'm going to grab the shaft of the penis with my left hand, retracting the foreskin. Now this hand is no longer considered sterile, it's now clean. So with my sterile hand, I'm going to grab my povidone swab, starting at the meatus and going down the glands. And we're going to do this 3 times. Perfect, and we can actually toss that out as well. Well, now asking the patient to bear down, we will start to insert the catheter inside, about 6 to 8 inches. I see urine starting to flow out now, so I'm going to go in an extra inch or 2. Alright, and I'm going to use my clean hand to hold on to the catheter and stabilize it. Now I'm going to insert and inflate the balloon with this 10 milliliters of sterile water. There, we've inserted that all, so we're going to disconnect that, toss that away. We can move the boat, we no longer need it. And so now taking the end of our drainage bag here, without compromising our sterility, we're going to take off this blue cap because underneath that it is still considered sterile. So we're going to put that on, throw that cap away. Now at this point, I would perform pericare. I would take away all of my all of my supplies that I use to insert the catheter. Make sure that the patient is clean, covered, and comfortable. I'm going to do an exit safety check, making sure the bed is at an appropriate height, they have their call bell within reach, there's no kinking in the tubing, side rails are up, and then I'm going to wash my hands, remove my gloves, wash my hands, leave, and document the procedure. So, today we inserted a 14 French 10cc catheter. I guess you could say February 7th at like 8 a.m. And we drained 500 milliliters of urine, let's say, pale amber in color, and no foul odor or hematuria noted. This was inserted to monitor the intake and output, and we did the procedure using sterile technique. The patient tolerated the procedure well, and our plan is to monitor the output of urine, so for the intake and output, as well as monitoring for signs of infection, and also initiating an intake and output record. Okay, so now there's been an order to remove the catheter. So I'm going to review that order. I'm going to wash my hands. and I'm going to bring the supplies that I need. So I'm going to need a 10 cc syringe. This one is a new one, clean. My sterile gloves are now clean gloves, and my pad here is now a blue absorbent pad. So I'm going to come into the patient's room, do a safety check, make sure call bell is within reach, no kinking in the tubing, no debris on the floor, patient does not appear to be in distress. Going to introduce myself. Hello there, my name is Katja Berthollet. I am a student nurse. Would I be able to look at your wristband today? Okay, so it says Jake Nursing, January 1st, 1960, and could you say your name and birth date out loud for me? Perfect, that matches. Okay, so today we will be removing your catheter as per doctor's orders, so you will now be able to void on your own. And the patient's very happy about that, been looking forward to that for a long time. So I'm going to look at the drainage bag and calculate how much is in there, and I'm going to write that on the intake and output record so that we are completely up to date for when we remove this. Now I'm going to put my syringe into the hub here, and we're going to deflate the balloon. So I'm going to let that via gravity, I guess, and pressure difference just kind of come out on its own. Okay, awesome. Pull on that a little bit more to make sure it's all come out. Okay, perfect. We can disconnect that. That goes garbage. And asking patient to take some nice deep breaths. We're going to remove the catheter. Perfect, and we're inspecting the tip to make sure that it's intact, checking if there's any blood or any pieces of it missing. Now we can actually throw out this entire system. So I would take all my supplies, throw it away. I would perform peri-care and make sure that the patient is clean, comfortable, and covered. Then after taking all my supplies away, take off my gloves, wash my hands, do an exit safety check, making sure the bed is at an appropriate height, call bell is within reach, side rails are up, there's no debris on the floor or any possible hazards. Then I'm going to leave the room and do my documentation. So we removed a 14 French 10 cc catheter, and the tip was intact, there was no blood on the tip at all. Patient tolerated the procedure well, and we are expecting the patient to void within 8 hours of removal.